Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. We have an incredible show lined up. We're going to get right to it. Hydrogen peroxide is a popular treatment in the world of alternative cancer therapy, but doesn't really work. Joining us to discuss is returning guest and friend of the show, Dr. Bryan Ardis, host of the Dr. Ardis Show and author of the best-selling book, Moving Beyond the COVID-19 Lies. Thank you for joining us yet again.
It is great to be here. How are you?
Doing good. Now, you've discussed on this show before, but can you explain peroxide and how that actually can treat cancer?
Absolutely. So for a quick summary, I was actually shocked 2 years ago to read a really short little book. It's a little paperback you can get on Amazon right now called The 1 Minute Cure. And it's all about using hydrogen peroxide over a 24-day period, literally 3 drops on day 1, 4 drops on day 2, and 8 ounces of water, and drink it. And all the testimonials you can read in that paperback book are all the different types of cancers that are cured within just weeks of using small doses of hydrogen peroxide. Now, to explain this to everybody, because it might sound really weird, every cell in the human body, as God or Mother Nature designed it, every cell in the human body is actually designed to produce hydrogen peroxide in your body. And it does it in defense of bacteria, virus, fungus, parasites, and poisons when they hit the cell of a human in the bloodstream, in an organ. Then the body releases hydrogen peroxide to destroy the bacteria, fungi, parasite, or poison that's actually attached to the cell that could infect it or make it diseased. And do you know what the number one mineral every cell in the human body requires to produce internally limitless amounts of hydrogen peroxide to protect you?
No.
It's actually copper.
Copper.
And what's interesting is all of medicine tells you to avoid copper supplementation. There's a ingredient, a chemical spread around all of the world called glyphosate. It's in all of our soils and in all of our plants. You're hearing about it in the MAHA movement with RFK Jr., Stephanie Sennett from MIT. You can read a whole book on it. Do you know glyphosate's number one action in the soil and in our plants is to destroy copper? Did you know that hydrogen peroxide, which requires copper, is what your immune system uses to kill off bacterial infections, viral infections, and parasitic infections?
Almost sounds like it's being done on purpose.
Oh, it definitely sounds like it's intentional. Oprah Winfrey came out last year, out of retirement, decided to do a whole 2-hour daytime episode on the fact that now scientists has confirmed that obesity is solely a genetic problem, and you need drugs like GLP-1 drugs like Ozempic and Wegovy. That's what you need now. Do you know that glyphosate is published by medical science to be something called, known to medicine, as obesogens? In fact, I'm going to quote for you what glyphosate does. Would you like me to quote this to you?
Absolutely.
Directly out of research studies, glyphosate that destroys copper, that now you can't make hydrogen peroxide to prevent infections and cancers. It promotes transgenerational inheritance of obesity, end quote.
Wow. So that means that based upon our diet, it actually, we can
bring it on.
Yeah, we can, we will then transmit those genes to be fat, to, use that term, instead of the actual obesity, to our children. So then it's going to continue on and on. I did not know that.
Imagine that, a mother eating food and then she gets pregnant, has a kid. She struggles with obesity because she's been consuming foods laced with glyphosate. And then she has multiple generations of children who are now going to be altered genetically to be fat and overweight, all because of glyphosate the mother or grandmother ate in her lifetime.
And then all of a sudden, Big Pharma gets to put out all their meds, all the pharmaceuticals, and have lifelong clients, generational clients.
And Dr. Ardis, you talk about chemicals. I'm reading here. Chemicals in food, drugs, vaccines, and cosmetics can cause obesity. Can you talk about that?
I can. In fact, really disgusting here. Anybody out there, 90% of all of your pickle jars that you see on shelves in grocery stores, which I find crazy. My 13-year-old loves pickles. Yeah, so I had to look at the pickle jars a few months ago, and I was like, wait a minute, how come every major brand of pickles in America has a chemical on the label called polysorbate 80? Now, polysorbate 80 is in almost every cosmetic men and women and children use: shampoos, conditioners, lotions, makeups. Polysorbate 80 is also in your childhood vaccines, COVID-19 vaccines. It is known to be an obesogen. Now, an obesogen, by definition, if you look it up, obesogens by definition mean this chemical, when consumed or introduced into the blood of a human, will make that human fat and unable to lose weight. So polysorbate 80 is in your ice creams, it's in your dill pickles, it's in your cosmetics, it's in your drugs, it's in ivermectin, it's in all of your vaccines.
It's in ivermectin?
Yep. So most of your manufactured ivermectin has polysorbate 80 in the tablets. So you might want to find one that doesn't have it in there. So if you don't want to get fat and be overweight and have risk factors for diabetes and heart disease.
Was it always that way? Because I've heard that they're trying to tamper with the production of ivermectin. So was that always the case for decades?
Yeah. Oh, polysorbate 80 has been used in drugs and vaccine production and manufacturing for decades. This is not new. In fact, polysorbate 80 not only does this, and I want everybody out there listening to me, they know they have ingredients in there that as you put it on your skin, within 7 seconds, it gets inside your bloodstream and will start to make you collect and produce more adipocytes, which are fat cells, to start accumulating in your body. Now, when you look at your labels, this is important. Polysorbate 80 is a name, but every time you see on your cosmetics, it's amazing. You'll see these words, initials, PEG, and a number. That is also polysorbates. And all of them are known to be obesogens.
We're going to take a quick break. We'll be right back with Dr. Bryan Ardis after this. You are watching American Medicine Today. Don't be screwed by lesser spine institutes who bait you with minimally invasive procedures, then switch to screws, rods, disc replacements, and hardware. At Benati, no metal hardware fusions are ever used. Benati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. Over half our patients have suffered from failed back and neck surgeries at other facilities. Benati succeeds where others fail. Welcome back to American Medicine Today. We're continuing our discussion with Dr. Ardis. So they're poisoning us. Where is the FDA?
Yeah, where is the FDA? In fact, did you know BPA, your plastic bottles? BPA, bisphenol A is what it's abbreviated for. BPA, which leaches from your water bottles, all of them, into your water that you drink, is a known obesogen.
What is the point of, where does this polysorbate come from and why is it in everything? Is it like one of these deep state things, to use that term from politics? Who's behind why this is in everything?
Yeah, this is incredible. So the FDA in America stands for the Food and Drug Administration. All drugs are chemicals. Why is the same building representing drugs manufactured from chemicals, also overseeing our food supply, creating disease and obesity that they know they can profit off of for you for life by prescribing drugs to you to manage now your thyroid issues they're going to blame on you being overweight. Nope, that's not genetic. You've actually been poisoned to be overweight and not be able to control your metabolism.
So now that we've given such a grim outlook to everyone, what steps can be taken so that we can save ourselves, because the FDA isn't going to help?
Yeah, I would recommend this for sure. So I just did an entire presentation, a virtual all-day conference on May 24th. If you go to healingfortheages.com, you actually get the entire PowerPoint with all the shown named ingredients in your food, drugs, vaccines, and cosmetics. It's time for you to do your own research and look up what you're putting on your skin, in your mouth, because it matters.
How do we detox, though?
Yeah, I would actually recommend those who are wanting to know how you detox these out of you. You should buy my Amazon best-selling book right now, Moving Beyond COVID-19 Lies, because the last 3 chapters are all about how to physically detox these poisons out of your body that were found in the vaccines, like polysorbate 80 and PEG 2000. Those are the 2 polysorbate ingredients in all of the American COVID-19 vaccine.
That's a lot to unravel here on the show. So we should have you back on real soon, because I want to talk to you about nicotine. All right. So that's the next topic. We'll get you on again in the future. Thank you so much, Dr. Bryan Ardis, host of the Dr. Ardis Show and author of the best-selling book, Moving Beyond the COVID-19 Lies. Thank you. for unveiling what is happening to all of us through these drug companies. It's really shameful, but thank you for sharing with us.
You're very welcome, and God bless you all.
God bless you. Thank you. Take care. Well, that's all the time we have for this segment. We'll have more after the break. You are watching American Medicine Today.
I'm Deborrah Sessions. I was in a level 10 and actually a level 12 pain. Now I'm 0 pain, no pain at all.
To understand how far she's come, you need to hear what she went through. Every single part of Deborah's life was affected.
Back a few years ago, from L2 to S1, I had fractures on the left and right side, and I was in severe pain all the time. Couldn't do anything. Standing, sitting, moving, sleeping, everything was an extreme amount of pain. I went to see different orthopedic surgeons here around Mobile and across the bay, and they wanted to put rods and plates and screws in my back. For me, it wasn't the right way to go.
That's when things began to change. Deborah's family found real relief from pain at the Bonati Spine Institute, and they told her about Dr. Bonati.
My brother-in-law had been down to see Dr. Bonati, my sister-in-law and I saw the results, and I said, I'm trying it. I don't have anything to lose.
Deborah sent her imagery to the Bonati Spine Institute for an evaluation. And what happened next, she still gets emotional about.
Dr. Bonati himself called me. And that is still, after all these years, that can bring me to tears, because I've never had a doctor call me and talk to me about my situation and what could be done. Dr. Bonati is so compassionate. And they were very truthful and honest with me about the anesthesia and, how that all worked. They allowed my husband to come in there with me. He held my hand the whole time. I remember some of it. You talk to Dr. Bonati to let him know if you feel any pain.
Then came the biggest surprise. Immediately after surgery, her pain was gone. And that same day, something happened Deborah will never forget.
Immediately. And they have you, after surgery, that day, they have you walk for 40 minutes. I love to shop. I'm a shopper. My husband and I found an antique flea market, and I actually walked the whole 40 minutes. I felt so good. It felt so wonderful to be out of pain while I was walking. I was so excited. I'm a very active person. And my husband he kept saying, we got to go back to the hotel. You're overdoing it. I said, you just don't understand how good this feels. This is so wonderful. I tell everyone. I've referred so many people. I've handed his name out, the address, the phone number. I like I said, strangers at the grocery store, at restaurants, at church, everywhere I go.
Now her life looks completely different, and it's all thanks to Dr. Bonati and the exclusive Bonati Spine Procedures.
Dr. Bonati and all of the staff, and the clinical staff, the surgical staff, I so much appreciate you. I'm walking, I'm running, I'm living my life. I am very active with my grandchildren. I'm very active in the yard. I have an amazing quality of life now. And that is the goodness of God with Dr. Bonati and for Dr. Bonati. So I bless him, and I bless the whole the Bonati Spine Institute.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. That's all the time we have for this episode of American Medicine Today. If you're interested in seeing previous episodes, add American Medicine Today to your favorite streaming devices. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.